Sometimes parts of our bodies grow differently, and today we're discussing one such condition near the brain known as Chiari malformation. Texomacare neurosurgeon Dr. Abdul Baker joins us today to talk about who is most commonly affected by this condition and how treatment may be able to help. Thanks, Dr. Baker, for being with us today. Can we start with what this is? What is a Chiari malformation?
Chiari? Okay.
Chiari malformation, there are actually several types of Chiari malformation, but in general, the most common type of Chiari malformation, which is type 1, means that a part of the brain called cerebellar tonsil hangs below the skull, and it encroaches on the space where the spinal cord first takes off from the brain. So there should not be anything compressing the spinal cord at any level, but because of this part of the brain that hangs down, it presses the spinal cord in some patients and can manifest in many forms in terms of symptoms.
And will the patients with this condition always even have symptoms?
No, as a matter of fact, there are a lot of people with Chiari 1 malformation that are completely asymptomatic. And oftentimes we end up diagnosing them incidentally because they may have had a car wreck and they get a CAT scan at the head or neck or an MRI for other reasons, and we pick up on that diagnosis.
Wow, so once they are diagnosed, what does treatment look like, and what is the prognosis following treatment?
Sure. Now, if the diagnosis is incidental, if they're completely asymptomatic, all you have to do is observe the patient. You go through an education session with the patient about things that they might encounter. If they do, then they might need to be re-imaged or revisited with a neurosurgeon. On the other hand, if patient is symptomatic, and the symptoms can be anything from headache and numbness and tingling in the hand or leg, that can form because of the spinal fluid flow that is disrupted from the brain to the spinal cord. It can form something called syrinx and lead to a secondary condition called syringomyelia. So a lot of things can happen, but certainly in a patient who is asymptomatic, you observe. In a symptomatic patient, you perform a surgery called Chiari decompression, where you end up creating more space at the level of the skull, where you create more space for the spinal cord and the brain at that junction, and the treatment is definitive.